For over 20 years, Clinics Health Group has provided world-class healthcare to underserviced communities. With every new facility we open, quality, affordability, and excellence is what we've become synonymous with. To that end, Cullinan Wellness Hospital is the latest addition to the group and the third in our growing roster of psychiatric care services. Located in Cullinan, east of Pretoria, our state-of-the-art facility is perfectly suited to service patients as far as Mpumalanga, Limpopo, and the Northwest Province in a tranquil setting surrounded by a luscious garden and mountain views.
It's very important for us to have such facilities in our communities because previously we've ignored the psychological instability. We thought we can go on with stress or depression, and because now that we have come out as psychiatric faculty to say we can offer this kind of care, treatment and rehabilitation for people who are in need of, who needs to heal emotionally or psychologically. So these kind of facilities are important to be. I would wish that every area would have this kind of wellness facilities.
I think mental health institutions and wellness centers such as this one are important mainly because we live a very rat race type of life and struggle to see when we are truly struggling with life. And being able to come into a facility like this allows one to pause and acknowledge whatever is happening in your life that is bringing you down, pause and regain function, pause and get back onto your feet in a way that you didn't even realize you needed. There's the need to have an out of your comfort zone area that will move and shake you as much as possible to get you back into a better state of you.
No matter the treatment or duration of stay at Cullinan Wellness Hospital, our patients and their loved ones can rest assured that they will be taken care of and watched over by our team of experienced mental health nurses, psychiatrists, and clinical psychologists.
Most of the patients that we admit are voluntary patients and they come on their own. The diagnosis that we normally work around is that patients with bipolar mood disorder, major depressive disorders, as well as post-traumatic stress disorders. Some has personality disorders such as gambling.
Our hospital provides private psychiatric services that aim to help the individual experience the fullness of life. We cater for a wide range of patients, including those with depression, bipolar, post-traumatic stress disorders, anxiety disorders, sleeping difficulties, neurocognitive disorders, dementia, and psychiatric conditions, amongst others.
My approach is I use what we call cognitive behavioral therapy, CBT. So basically it's helping, because most of the time I've noticed that we tend to be depressed or go into mental problems because of the channeling of our thoughts. We tend to think, if you are going through a difficult situation, you tend to think more negative about it than thinking positive about it and actually getting a solution. So I just help my patients to come up with solutions, and hence I use solution-focused therapy, because I'm confident that they do have solutions. It's just that sometimes they're not confident to put them into action.
My approach when treating a patient goes back to the good old Batupele principles. We follow a very client-centered approach. Every case is different, and so applying Batupele principles where it's about the patient, it's about dignity, it's about ensuring that the patient's needs are met, is at the core of practice, is at the core of all intervention.
As mental health practitioners, we encourage individuals to visit our facility so we can assist them in finding routine solutions to the problems they face on a day-to-day basis.
I think from a very simple point of a non-functional mind is a non-functional human. And neglecting mental health means, in essence, neglecting a whole part of yourself that is very necessary to maintain function on a day-to-day. The more we ignore the brain and the psychology and the emotions of a person as we have been, the more we are likely to not reach to the full potential that we could.
At Clinics Cullinan Wellness Hospital, we believe mental health is the cornerstone to helping you find and lead a happy, balanced life. Visit our magnificent facility at Hospital Road, Cullinan, Pretoria East. We're open 7 days a week and are ready to receive you.
Good evening, colleagues, and welcome once more to our weekly webinar, Clinics weekly webinars hosted by Clinics Health Group. It's a great pleasure to be in your midst once more as we continue with our webinars to just bring you topics of interest to yourselves that you want us to discuss some of these topics. And we are glad that we have been able to do so since the beginning of the pandemic, COVID, and most of you have kept with us, and we really appreciate that you have always been here to support us as we continue to bring you speakers from various fields in medicine and backgrounds in the healthcare industry as a whole. And we are doing that once more this evening. And please note that these webinars are CPD accredited, and we hope that when you registered for this webinar, you provided us with your full details so that we can submit your information, and that those who are registered with the HPCSA will get the CPD points uploaded immediately. You don't have to do anything, just as long as you've submitted your information and the correct HPCSA number. So you get your CPD points. And all other colleagues who are from nursing council or pharmacy or allied health professionals, that information will be submitted to you. Those who get certificates for attendance, they will get those certificates. And we also request that as you log in, make sure that you mute yourselves and you switch off the videos so that we improve the quality of the reception that we're getting. We know that we're in the days of load shedding. I just said load shedding. Fortunately, the power is back now. I'm back on the main electricity supply. Also note that these webinars are also recorded live on YouTube. So at any time after this evening, you're at liberty to go and go to YouTube and see the recording and the presentations at your leisure. But also make sure that you do like us on YouTube so that you get notifications about future webinars. And so this evening, we're excited to be bringing Dr. Brenda Kubheka in our midst. Dr. Kubheka is actually the brains behind these webinars. When it started, when she was still part of Clinics, she came with the idea that we should have these weekly webinars, and I was glad to be part of that team that started under her leadership. And so we brought her back this evening as a guest speaker. We've been doing mental health this whole week, this whole month. So as we close this month, we went back to the ethics of artificial intelligence and robotics in healthcare. We had a full month discussing artificial intelligence and medical technology, where we had various speakers showing us how artificial intelligence and advances in medical technology can be used to enhance medical care. But as I was talking to somebody today, that all these advances, we should bear in mind that there should also be the ethics behind all this. So Dr. Brenda Kubheka is going to be helping us to deal with the ethics behind the use of artificial intelligence and robotics in healthcare. Dr. Brenda Kubheka is the founder and managing director of Health IQ Consulting. and also founder of Women in Healthcare Summit, and also co-founder and Match Media. She's an entrepreneur. And, it's quite rare to have someone who's an entrepreneur, an ethicist, a researcher, an activist, she medical doctor. She has an MBCHB from the then Medical University of Southern Africa, or now currently the Kubheka University of Healthcare Sciences, and MBA from Gibbs, and a diploma in business administration, certificate in media and medicine from Harvard Medical School, and also got qualifications from the African Leadership Initiative, a published author, and currently a PhD student. So Dr. Brenda, we're quite happy to welcome you back to this platform that you started as a speaker, and we're looking forward to gaining a lot of insights from what you'll be sharing with us this evening. Thank you very much.
Good evening, and thank you, Dr. Vila. I'm a victim of Murphy's Law. I don't know what happened. We just lost power, but I'm just happy that I am online and able to join. So I am going to keep my video off for the sake of bandwidth. I'm not sure what is really going on right now. Firstly, just thank you for inviting me, and good evening to the colleagues as well. As Dr. Bila has mentioned, I will be talking about ethics of artificial intelligence and robotics in healthcare. So this is the outline of my presentation, looking at health and its social determinants, digital transformation in healthcare, and the sources of healthcare data, artificial intelligence, robotics, and we'll look at the benefits and ethical considerations, and that will bring us to the end of our presentation. So what is health? It's basically a state of complete physical, mental, and social well-being, and it's not just merely an absence of a disease or infirmity. This is the reality of South Africa. Apparently, as we speak, we rated the highly unequal country in the world when it comes to income. And that is a popular picture that we normally show when we talk about inequality in South Africa. So there's what we call lotteries of biology, which also contribute to inequality. And if you look at issues of equitable access to care, etc., issues like age, gender, ethnicity, disability. And then there's what we call the lotteries of life. The lotteries of biology, no one has control over that. It's basically what we are born with. We don't choose also, our gender and our race, etc. And then the lotteries of life, because of where we live or where we were born, and the socioeconomic status of where our parents, etc., they have an influence on the quality of education that people actually receive, and the type of housing they live in, etc. Now, if we talk about social determinants of health, the main thing and the important thing is that health actually happens outside of the health system. So if you look at the social determinants, level of education, work, the kind of support they have, and other factors which has to do with behavior and lifestyle, they have an impact on the health of individuals. Again, when it comes to education, most people don't actually have a choice of the type of education they actually receive, but it's all dependent on where they stay, except for those who have options and choices, who can send their children to other better schools to receive maybe high quality education. So this is something that we really need to keep in mind, especially in a country like ours. Again, if we look at the health behaviors, they also have an impact on the health of the individuals. At the same time, even the health behaviors sometimes are triggered by the environment where people actually live and where they play. And if you look at new development, especially your RDP houses, etc., and you look at the planning and if there are facilities, recreational activities for children, if there are parks and places for people to walk. And these are some of the critical things that we need to look at and advocate for as health professionals, because they have an people's health. Now, just looking at different healthcare models. We have the biomedical approach and the biopsychosocial approach. The biomedical approach, basically physiological, biological, it's related to disease, the care and the treatment, and it's mainly centered around health professionals and health establishments. And then the biopsychosocial approach is actually broader because it looks at a person as a whole, that human beings are psychosocial beings, other than having cells and tissue, etc., but they also have a psychosocial features to them, and also those they impact on the quality of their lives and also their health. So it's important to look at the two models, and it is going to become important as we go along. So if we look at the impact of the adopted health model between the two, so it influences budgetary allocation, it influences resource allocation, it also health messaging, and also stakeholder mapping. But I just feel like we have a missed opportunity if we look at Enyobeni and that incident that happened and those young children that passed away, and the importance of us, again, as health professionals who are supposed to be advocates for the society, to ask the fundamental questions regarding, I know we talk about parenting issues and why parents didn't know where their children were at and stuff like that. The question is, in that particular environment, themselves. And again, what is it that is abnormal that has been normalized? And looking at stakeholder mapping, when solving such problems, which are the sectors other than health that need to get involved and take ownership of coming up with solutions? So now we look at COVID-19, it's part of us. And actually a mirror that highlighted the pre-existing issues in our societies, whether we're talking the way, again, houses are designed, and when people had to isolate at home, and if there's 10 people in one household with 2 rooms, what does that really mean? At the same time, please excuse the typo, it provided a platform for accelerated digital transformation, and obviously for one, to increase capacity to respond to the threat, and then 2, also to use digital tools to protect health professionals and even patients or society from cross-infection. If you look at telemedicine, etc., we can name quite a few technologies that the utilization actually increased during the pandemic. So this accelerated digital transformation during COVID-19, in the first quarter of 2020 alone, almost 1 billion was invested in AI-focused healthcare startups. And most of these startups were looking at coming up with solutions that were focused on COVID. And then a recent projection also shows that the global industry is growing at a rate of 44%. Will grow at the rate of 44% until 2026. So this, we are talking about healthcare AI. So when it comes to solution and innovation, the question is the technology an enabler or a solution? And then the first important point is the scoping of the problems and being clear as to what is being solved so that that technology solution is linked to or targeted to a problem, a specific problem. That example and the picture that I've shared there, basically the doctor giving a note to a patient saying that to save time, please take off your clothes now. This is just basically to depict that if the problem is not properly scoped, the solution will be misdirected. And then secondly, the solution may even cause harm to the users or the intended beneficiaries. So technology should be focused and specific to a problem so that the intervention is actually effective. And also a need for multi and transdisciplinary approach. I always look back at the peak of the pandemic, how as a country we responded. I mean, the private sector, the public sector, and academia, working together. We found the engineers also coming up with solutions that are relevant to healthcare. And we just need, I think, to build on some of the successes, especially when it comes to technology, innovation, and implementation thereof. So quickly, I'm just going to move and talk about dimensions of quality. Achieve the intended objective, it must cause no harm that is preventable, and it must be available at the time when it is needed. So that was just the background information. So let's define what artificial intelligence is. It's the ability of a computer or a robot controlled by a computer to do tasks that are usually done by humans because they require human intelligence and discernment. It mimics the problem-solving and decision-making capabilities of a human mind. And then we have what we call augmented intelligence, which is amplified, and it is an augmented human intelligence. So it's basically AI that is enhanced because AI is functioning at a level of a human, a normal human. And what is important when it comes to augmented intelligence is the question of, does it work like a human, which is AI, versus it's an enhanced human worker. So are there benefits of AI and robotics in healthcare? I think it's a simple answer, which is yes, because it does add value when it comes to population health management, clinical decision-making. You can imagine the number of journals that all of us would have to read to keep up with, developments in healthcare and also advances in technology and in medicine. Also, it's been used to assist during surgery and improve access to healthcare, and then optimize performance and operational efficiencies. And that's also related to automation, etc. So the benefits are many when it comes to AI and robotics in healthcare. But then what should AI aim for? We've already spoken about better clinical outcomes because it computes a lot of data and information. And then, let's say in the clinical setting, we'll make recommendations based on that data that has been analyzed, if we're talking about journal articles. It also the improved patient experience, if we can cut the waiting times, if we are able to predict that patients above 60 that are female staying in Soweto will probably need this kind of, let's say, treatment or care. That predictive capabilities also improves patient experience, cost reduction, if we can actually realize that when there's less time that is wasted, because also time is linked to rents, and also if care can be provided to a large number of people at a less cost. A better quality of life of clinicians and other healthcare workers. Just the simple example that I also gave earlier on, the fact that you have to read like thousands and thousands of journal articles and be able to apply all that knowledge every day with every patient, and also looking at each and every patient as an individual with unique, characteristics. So there is value. And the two that are normally left out, which are quite important when it comes to ethics in healthcare, is the improved access to care, which also reduces health disparities. If access can be improved, and people that are less off or have some sort of an advantage also are catered for. So it means that they will be able to access help or care better than before AI, the implementation of AI tools. So for AI, data is life. It's like oxygen to a human being. So now let's talk about data intelligence continuum. I know this is, most of the colleagues are familiar with data issues. So data basically has little or no meaning without context. And then moving to information, which is structured data, and this taking context into account and relationships. So it's basically data that has been processed and has meaning, and it can actually be utilized for decision making. Knowledge, then it understands the patterns and used for decision making. Intelligence is the ability to acquire and apply knowledge and decision making. You can actually now link these data intelligence continuum to artificial intelligence, and the definition that I gave earlier on. And then lastly, it's wisdom, which is the understanding and the futuristic approach, looking at principles and context. And this relates more to that augmented intelligence that I spoke about, because it has an element of human centeredness as well. So if data is like oxygen, where are we getting this data that informs artificial intelligence and machine learning? So it's the clinical data that, the normal data that you collect all the time, from demographics to test results, to discharge, length of stay, etc., and diagnosis, and then medication, and then claims-related data and prescriptions. Now moving to genomic and genetic testing data, when we look at molecular profiling, and then family history, the historical data and health conditions and allergies. Hence, it's important for people to understand their family history. And at the same time, it's actually quite interesting if you look at the amount of health data that can be extracted from social media as people share, their medical history, also without thinking of the implications for themselves and also implications for their family members as well. So there's various sources of health data and the mobile apps on our phones, and that's reported by patients, and then literature as well, which is what is published and shared out there and available mainly on online. So why should we care about AI ethics? We should care, one, because, hello, oh, okay. Making for diagnosis. And if we think of COVID times, you know, the surveillance and also the early detection and all the information that is collected through various data points, like, for example, our wristwatches, in the output of that aggregated data, if it's published and stuff, it informs research, and that information life issues that also we need to keep in mind. I mean, recently, there is an AI tool that is being tested to assist with decision-making related to euthanasia. And now it's basically also delegating some of the moral decision making to an AI tool. That's the reason why we should care. So the challenges of AI in medicine. So the first one is data. If we just think of our country, South Africa, you know, how health data is collected and stored and shared, it's pockets and silos that are not talking to each other, which then compromises the ability of having that big data that can be computed and excuse me, computed and used for planning, decision-making, predictions, etc. There's issues related to data inaccuracy, data security, and this always makes me, you know, smile when people ask if patient records as health professionals, if they belong to them or they belong to the patients, issues of data ownership. And if certain platforms are utilized, technology platforms, to manage data, let's say, for example, in a practice, and do we know that in the background, those service providers, if they are mining that data and also using it for other reasons, especially if we think of Kubheka, if we think of truthfulness, transparency, etc. So on the technology side, we'll talk about later on the issues of black box, etc. And then there's also the cost issues, which sometimes become debatable. And, you know, innovators tend to say that cost, we normally use it as an excuse because we don't want to adopt new things or open ourselves up to using technology more widely in healthcare. And then on the people issues, it's lack of AI education, it's the trust issues, and the shortage of data scientists, and then the lack of clinician champions to actually drive, you know, these AI solutions from design to implementation to monitoring. And others, it's legal bias, data privacy, and we are going to address some of the issues later on. So continuing with the challenges, it's the algorithmic bias. So, excuse me, there will, according to Patch, there will probably always be some amount of bias because the inequities that underpin bias in the society already influence who gets the chance to build the algorithms and for what purpose. So it's the issues of who is exposed to AI, who has the skills to work in that environment, who gets to sit around the table and also make the decisions, who gets to ask the questions that ensure that whatever solutions and the algorithms have taken into account some of the social issues that are not uniform across the different population groups in different countries or even in the same country. So it will require normative action, which is basically an ethical inquiry and ethics impact analysis and collaboration between the private sector, government, academia, and society. So algorithmic bias, it compounds existing inequities and amplifies inequities in the health system. So issues of socioeconomic status, race, ethnic background, religion, gender, disability, sexual orientation, and we can list a few more. Again, those algorithms, there are people behind the development of the algorithms. And if there is no ethical framework of, of conducting an analysis during the design, actually the life cycle of the AI solution development, then there is always room for these biases, because it's the biases of the people that develop, the algorithms that also get entrenched. And also it's the information that is already existing in the system that if it's used for machine learning, it also perpetuates some of those inequalities that exist in the society. I remember a while back, I think a couple of years ago, where one of the big banks in the country was accused of racial discrimination when it comes to applications for home loans. And then it was discovered that actually the whole process, if not the whole process, but the majority part of the process is automated, or at least the initial phase of the process is automated. So if it's automated and it's based on, let's say, for example, Black people don't pay their, they don't pay on time or whatever, or houses in townships are high risk, so we should not consider or ask for a high deposit, something of that sort. So it's quite, yes, important, for the biases to be, one, it's the issues of awareness, and then two, yes, now that we are aware, what can be done to actually reduce, the impact of bias in perpetuating inequalities. So this is an example of an app, obviously developing the app and training the algorithm. And the app is for the diagnosis of skin cancer. And the training data that was utilized in this particular case was mainly of people with fair colored skin, as in white people, and a few of people with dark skin. So the training data is from the point it starts, it's not truly representative. And from that point, and the model and the algorithm is trained, and the algorithm is, there's application and implementation. And then with that flawed data and the algorithm, there is a bias towards white skin. So there is a huge risk that it will say, diagnose that there is no cancer or exclude the presence of skin cancer in dark-skinned people, because the problem started from the design where the training data was flawed, and those issues were not raised. Again, do not exclude other racial groups. So questions to ponder: who is behind the algorithm? What are their biases and stereotypes? Who's making the decision? Sorry. And then the issues of business profits over patients, and implementing or launching prematurely before doing an ethics impact analysis of some of the solutions. And then also, what is this ethical legal framework that should guide, the developers and the entrepreneurs and the innovators when it comes to developing the new solutions that are AI enabled. So why should we care? I've already addressed the issue of skin color and racial biases in some of the algorithms. But recently, what is encouraging, because there has been movements that have been asking the right questions, and especially when it comes to darker-skinned people and issues that are related to the socioeconomic status of certain communities, that now the artificial intelligence, although we know it can feel racial bias in healthcare, but it can also mitigate it. Now, with asking the right questions and having more diverse, team members, and also the introduction of data ethics, when it comes to the scientists working in that space, data scientists, etc. So it is making a difference and a positive contribution, especially when it comes to data governance and how that data is being utilized. So issues related to trust and digital innovation. Obviously, the question is, whatever the solution is, was the data sufficient to actually make us trust, that AI solution? And then secondly, it's the alignment of that with legal provisions, like, for example, POPIA issues of privacy, data storage, etc. And then a robust accountability mechanism. So if something goes wrong, there's data leaks and stuff, what happens? What are these accountability mechanisms? And then the safety and efficacy, which is related to issues of data security, etc. And then just the trust between the developers and the end users, funders, and regulators. This one actually makes me think of, COVID-19 surveillance tools that was implemented by our Department of Health, and how many people actually subscribed to it and used it. And the questions again is, was there adequate trust between the different stakeholders or not? So why the lack of trust in AI? Again, it's the issue of threats to privacy, data breaches, lack of transparency. We'll talk about the black box, the fact that some of the information is not explainable, and how do you implement or trust when you can't explain how, that AI solution came up with a recommendation. And then the bias, we've already spoken about that. And then issues of intuitive decisions based on multiple algorithms. And I think we can also link that to the black box, which we'll talk about. So black box, a device, system, or object which produces useful information without revealing any information about its internal workings. So this is one of the challenges that is found with AI, and it does have an impact on trust. Again, if you can't explain it, how do we trust that the output is credible? And how can we trust that if a human being implements that, issues of liability, etc. But the main thing is about explainability. So if we have an input, we must be able to join the dots as to how it came up with that output. So we spoke earlier about the benefits of AI and robotics. It's important that we build trust through improving collaboration with clinicians. So In the development phase, clinicians and data scientists can work together to define their goals using AI in healthcare and understand how the data can help them achieve those goals. And then, excuse me, with the involvement of the clinicians, there is that understanding of what the data is saying, what are the limitations to the current data, and potential biases in the data. And then on the implementation, again, clinicians have a better understanding of the workflows and the culture in the healthcare system, so which is something that is lacking from the data scientists, hence the importance of improving collaboration. And then on the results, it's a teamwork approach, improves transparency, and then reduces black box algorithms, because the clinicians will be asking, how did we get to X? Are we able to? And if, again, it's not explainable, then that So again, just highlighting the value of AI in the healthcare ecosystem, better decision-making because of big data and the ability to compute large volumes of evidence-based guidelines, etc. And then building the trust between entities, patient autonomy, enabling that, and then data responsibility, where patients actually own their data and they can decide how they want to share it, and issues related to data philanthropy, where patients can also donate their data for research without having to go through, the health professionals, because it is their data and they have access to it. And then transparency and explainability, this talks to black box, and that is why there are advocacy groups that are advocating for transparency. They are raising the right questions and making sure that there are accountability mechanisms, especially to the population groups that are negatively impacted, whether because of exposure to AI, they don't work in AI, and other factors that have a negative impact. So earlier on, I did mention that data is life when it comes to AI. Now the question is, if we look at information management in just in South Africa, how are we doing right now, and how is that going to impact the future of AI in medicine? Because its success is rooted in the quality and integrity of biomedical data and databases. Again, the question is, in the different facilities, the different departments, wherever, the people in charge of informatics and data management, are they suitably qualified, And then issues of storage, the how we store, maybe collect first, and then store data and clinical information, is that enabling, the computation of that information? So these are the questions that we should be asking, and they are so relevant in the future of AI, and just, when it comes also to planning and other uses of data in South Africa, including research, health research, public health research, etc. So again, the question is, how are we doing as a country? And whatever the answer you have, how does that position us in the future of AI? So this is South Africa. It's an unequal country. We have a digital divide. And the young lady is excited and probably achieves the daily goal when it comes to the steps. But we have so many people that are moving around, walking every day, and quite active, but they can't afford the digital devices to collect that data. So these are some of the things that we need to think about. And So coming to risk assessment using multiple data sources, for example, if you think of insurance companies and the amount of data that they have, and most reliable because it's huge data sets, and collecting data from multiple points, maybe it's from the smartwatch to the bank card to how you drive, etc., etc. So basically, one person is a multiple data source, and the people on the other side not probably, they know you more than you know yourself. So that data can be instrumentalized and used against the individuals. So hence the importance of having those advocacy groups there to make sure that data is used for the intended purposes. And when that is under threat, questions are being raised, and then also people and organizations are also account. So coming to governance, and now knowing that data is the new oil, like if you think of mining and other industries, I mean, think of the black diamonds and countries that have oil. I mean, these are lootable resources because you can actually, they're physical resources. So where there's interest, there's also what we call the rent-seeking behavior, which is basically just corruption. And then also the new oil becomes the source of conflict. Now, who owns the data and who has access to the data and who uses the data that is available for, for reasons that are not known to the, data owners, like the patients, etc. And then also keep in mind that the health sector is the second most hacked sector in the world. And again, it's a sector with a lot of data, and it's a sector with very sensitive data that can be used for blackmailing people and individuals, and also blackmailing, facilities and hospitals, etc. So looking now at liability, if you think of AI solutions that assist with clinical decision-making, AI is just that augmentation of intelligence, but it does not dictate. So one can never say, or say that they are not liable for the care provided to the patient because the AI clinical decision-making tool said they must do X versus Y. At the end of the day, the relationship is between the patient and the practitioners, and that relationship is built on trust, respect, transparency, and accountability. Now, just looking at equity, diversity, and inclusion, this is a smart watch, and which showed there's 10 studies that were conducted and reported on when it comes to the smart watch, looking at the heart rate between people of different races and different skin tones. And again, it's because of the fewer data points from darker skinned people. And you can imagine if this is a health technology or outpatient basis, but that informs decisions and the care to be provided. So how do we make AI inclusive? One, it's diversity, just making sure that the group involved from design, ideation to design, transparency. It's why is the tool being developed, and for whom, and how is it funded? Because also funding can also influence decisions and issues of profits, and sometimes the cutting of corners and stuff. And then the education, just to make sure that everyone is included. So in those groups where there's underrepresentation, for them to be exposed to AI tools and also to gaining the skills, because what you don't see, you will not do. So it's that active exposure. and then advocacy to remove barriers faced by Black people. So there are a couple of advocacy groups, mainly based in the US, that are working on this and making sure that it doesn't impact on this specific population group negatively. So looking at the ethics impact analysis, again, is just the basics, the 4 principles of ethics: autonomy, justice, do no harm, and ensuring that what is being implemented will benefit the patient. And then when you look at ethics impact analysis, it's the suitability of the tool, the appropriateness based on the context, the applicability, and also the effectiveness. But the last one is also the sustainability, because once a tool gets implemented, there's an opportunity cost, because something will be, you receive the new tool, you let go of something. So the issue of sustainability becomes also important. So in conclusion, the future is here and it is digital. And then the ethics impact analysis of AI and robotics is important. We talk about responsible innovation. Patients in the society do not know what they don't know. So there's a high moral calling for the clinicians and for the developers to ensure that technology actually the question is now, is our training relevant for the digital future? If you think of medical training and the current medical student, how much exposure are they getting when there's already so many tools that have been deployed out there? Again, let us join the digital movement, but ensure that the benefits always outweigh the harms, and we take extra measures to reduce harm, bias, and all that. Thank you so much.
Thank you very much, Dr. Brenda Kubheka, for this in-depth discussion on ethics in artificial intelligence and how we can utilize it to advance medical health for our populations. And I think you touched on a very important subject that in terms of medical training, whether I think we also worry about whether the students are trained on this digital technology. But the thing is, who's going to be training them? Just we spoke lots about people struggling with ordinary computers, BBTs. Now, if we've got to go to AI and the trainers themselves, are they capacitated to be taking forward AI in our settings, maybe in our South African setting?
Doc, I cannot say yes or no, but the ones that I know that are medical trainers have their own challenges, And I think it's also just looking at partnerships. We have universities of technologies in the country. We have schools of engineering. So the question is, how do we collaborate? Firstly, maybe just defining the why we need to do that, expose the students to technology, innovation, etc. And then 2, what is already available and where is the capacity and the skills and the expertise sitting? They are in the schools of engineering, in the universities of technologies and stuff. So there's opportunities to collaborate in the country. And there's also opportunities to collaborate even outside of South Africa, where there are structured programs that could possibly be offered to students online.
Okay. Yeah, I think there's possibilities are quite many. There's one of the Dr. Snyman says privacy and also data is a very important ethical issue that perhaps you haven't really touched on. Any comments on that?
Yes, remember, one, it's the human rights issue in this country. So privacy is quite important. And I think I mentioned also, I touched briefly on POPIA, which also we are all expected to comply with. At the same time, we think that we comply with POPIA and we are protecting the human rights. But again, some of the platforms that we're utilizing, we do not understand how far they use the data and what they use that data for. And those are some of the things that now we need to start asking. When you sign that contract with your service provider, the issues of when there's a breach, what should happen and what should they, you should be looking at that and asking for those clauses to be included. And also the clause on the use of data, because that data that you have collected about the patient, it's basically to care for the patient. So it's between the medical practitioner and the patient, and no one else should be utilizing that data. Again, it's just those questions that need to be asked, and in those contracts, it's now starting to ask those specific questions and making sure that the I's are dotted and the T's are crossed.
Okay, no, thank you very much. Maybe you could stop sharing and then maybe switch on your video. So as we welcome more colleagues to ask questions, I don't see questions. Maybe colleagues, please don't hesitate. It's quite an important topic that we've so much information, Dr. Brenda Kubheka. If you've got any questions, please don't hesitate to post a question on the chat line, and that we will be able to take that. One of the comments is not about the presentation itself per se. It's to say, are you able to share this as part of the privacy and intellectual property? This presentation, I know it's available on YouTube, but someone says, are you able to? Can we share it?
Okay, I think Doc has already mentioned that it's available on YouTube, and I will encourage colleagues to actually access it from YouTube. Thank you.
Okay, thank you. Yeah, because I thought maybe that's why we use that platform. Then the other question is, where are we with telemedicine in South Africa? I know with the advance with COVID that had to be fast-tracked. A question of maybe doctors, patients communicating, and also because patients are not able to meet physically with the doctors, there was provision made for consultations to be made telephonically or otherwise, and also prescriptions to be provided without necessarily patients being consulted directly by the doctors.
Okay. Unfortunately, I'm not in a position to say or to give an opinion because I don't have access to that information. So I will just respond generically and say, yes, telemedicine was launched in response to the pandemic. And I think things that we need to keep in mind is the issue of acceptability, and depending where the practitioners actually work and the types of patients that they have, some prefer to be touched, to be seen, to be listened to, and to go to the practice physically. Others, and those that are tech savvy, probably will still continue utilizing telemedicine. But I know that when it comes to mental health, there seem to be a sustained increase in the utilization of telemedicine. So I would say that it would differ from one specialty to the next, and probably also differ depending on the community that whether the facility or the practitioner is currently serving.
Yeah, there's a follow-up from Clyde Thompson who has this question. You may unmute yourself, Clyde, and ask the question.
Thanks very hi, Brenda. The reason why I posed the question was because Health Professionals Council on their booklet 10 pertaining to the ethics and the procedures around telemedicine, there was a question raised by Medical Protection Society as to the clarity of the rulings or the guidance that was given, that there was no conclusivity. So if I do then decide to practice medicine by using telemedicine approach, would I be practicing within the realms of safety according to the Health Professionals Council, or would I be exposing myself to any sort of medical legal challenge? Thanks, Ray. Thanks, Brenda.
Okay. No, thanks, Clyde. I think when it comes to risk, it will differ from one person to the next. And obviously, it's not so conclusive. All that I can say is each professional, you need to get advice from your legal representative or indemnity service provider as to, with regards to the specific area of medicine where you practice, what does this actually really mean? We also have a responsibility of ensuring that we reduce the risk and we achieve what is intended by healthcare, which is improving the quality of life and actually people getting better from the service. So the last comment, technology is not the solution, but it just facilitates access and maybe makes it easier, etc. Thank you.
Yeah, there is a question, Dr. Letlape, who's host Letlape says, well, maybe you can comment even about telemedicine if you so wish, Dr. Letlape. What is the role of ethics committees in protecting subjects of research with respect to AI use?
It's quite interesting and a new area. I know there was a workshop. Unfortunately, I couldn't make it. I think the last day was yesterday in Cape Town, basically looking at research ethics committees and how to assess protocols that are requesting ethics clearance. It is a new area, and so there is a framework that needs to be adopted to ensure that those are assessed equitably, fairly, and at the same time, the research committee members understand the risk and the benefits also of having those AI-related, research conducted. So yeah, so that is my response. And I think maybe if you reach out to Stellenbosch, the bioethics division, and they'll probably provide more information. But I know there's a lot of work and good work they are doing at that center, including at VETS at the School of Law, where they are focusing on big data, AI, healthcare frameworks, ethical legal frameworks relevant for the low-income countries like South Africa.
Yeah, it's a big industry. Raina Abraham wants to know, what are the common problems that can relate to the technical and organizational challenges of introducing telemedicine?
Okay. Thank you. I think the first question is the why. Why do you want to introduce telemedicine in a facility, and what is the problem that the organization is trying to solve? And then two, it's the issue of getting the right tools that comply with POPIA. If it was the US, it's the HIPAA compliant tools, of which even Zoom is one of them, but it's a different subscription, of course, for healthcare, although some of our colleagues are using Zoom, the normal Zoom for telemedicine, but it's important for colleagues to understand that there's, privacy issues that needs to be complied with. And then thirdly, it's the change management. So it's change management, the adoption of new technology, the new way of doing things. And remember, healthcare is it's a profession of caring, So now we're talking about virtual empathy and, and you're not with the patient in the same room. Can you really read the facial expression, etc.? So those are some of the things that need to be kept in mind. But obviously, if the organization invests in that, it must be clear, it is for this reason, it is for solving this problem, and this is how the users, even within the organization, are going to be supported to ensure that they do the right thing and they also understand what are the risks and the benefits. And then on the other hand, is also maybe taking some of the patients along with you, those that are tech savvy or that don't trust technology, etc. But at the end of the day, that telemedicine solution should not, cut some of the patient out of care inequitably. So so that would be my advice with regards to launching telemedicine.
Maybe not so much related to the subject that we're discussing. I know that you were giving a talk the other day on social media, because I think with telemedicine, it also deals with social media and sharing of patient information and data on social media. What can you say in terms of that? I know it's a broad subject. Now that we tend to be talking about telemedicine and also patient, but sometimes inadvertent that information lands up in our mobile phones and social media. Just a warning to the practitioners.
Yes.
Before I come to the club, yeah.
Okay, when it comes to social media, the main thing is do no harm. And there is a relationship between the professional and the patient, and it should be based on trust and transparency as well. And practitioners have a legal obligation of protecting information that has been shared in confidence, and also that understanding of the power imbalance between them and their patients. So sometimes you will find patients agreeing to have their pictures taken, and whether they've agreed to have them posted online, I doubt it. I've seen a post where the diagnosis of a patient is actually out there. The fact that you can't see the face, it does not mean that you have the right to share the information. It's patient's record, it's issues of confidentiality, it's respect for other human beings and dignity to others. You can't treat them as objects of entertainment, objects of marketing, etc. We cannot treat people as a means to an end. So we have to respect. And I would say no information about patients on social media unless it is clear that it's for educational purposes and the patient is aware, even if it's an X-ray picture, that you are going to be sharing their X-ray picture online, and for what purpose, and they need to provide consent, not just permission, informed consent, that they are aware of explicit consent, they are aware of all those benefits and risks and why the practitioner wants to share.
Okay, thanks a lot for that. Yeah, Dr. Letlape, your hand is raised, and I saw you also posted a question. Maybe you can take both.
Yeah,
go ahead.
If you can hear me, just the issue about telemedicine. The rules don't change. The ethics are the same. It doesn't matter what tool you use, whether it's AI or what technological advancement you are on. Remember that the key issue is that you should always act in the best interest of the patient. You should do what you trained for. You should perform things that are accepted as standard treatments where there's agreement in the profession. Because if there's a complaint, you're going to be judged on what would a reasonable professional do, what is the standard treatment in relation to what the complaint is about. If it is something new and you are venturing, it may be seen as experimental treatment. And did you follow the protocols? Did you explain to the patient that this is not standard treatment? Was there room to get approval either from the ethics committee, a therapeutic committee, SAPRA, etc., etc.? So I think people need to refrain from being fearful of technology, but they must also understand that the basic rules about patient protection, privacy, permission to take a picture is not permission of usage. Because if you want to use it for a particular purpose, that needs to have been fully disclosed. And you must have written consent with respect to what is being disclosed. So that people, they just need to understand that we shouldn't fear this. But it is important that the professionals incorporate AI and accept it and put it into clinical protocols and into treatment guidelines and into this is what is expected of you. This is what is approved by your peers. Do not experiment with patients, because otherwise, when there's a complaint, you're going to come out badly out of that situation. The rules are simple. Patients first, and the ethical rules apply. Technology is an enabler and cannot take responsibility. You can't tell us that the AI said, because the patient didn't come to consult AI. They came to consult a healthcare professional. And we regulate healthcare professionals, not technology.
Sure, thanks for that comment, that it's the normal practice of medicine in terms of patient safety and also the ethics of attending to patients. You had a question also about complaints from the patients. What standards will be used to adjudicate?
The thing that I just mentioned speaks to that aspect as well. Because when you sit as a committee, it's going to be, you did this. Is this what your colleagues do? When they bring in an expert, they'll bring in an expert peer to say, in this circumstances, this is what is expected. This is how it's supposed to be done. So it becomes important that the protocols should exist for you as a reference point. Because if it is not there, it means you're coming with something new. You're experimenting on a patient. Now you are into, Declaration of Helsinki, subject of research. Did you do proper research? Did you do proper disclosures? That's the context in which the question was asked. But if Dr. Kubheka has more answers to that question, I would welcome that.
Okay, sure. Thanks for that question. Yes, Dr. Brenda, you want to make a comment?
I think he's covered it.
The main thing is, thank you very much.
Yes,
there's the next question from Peter William Ashman. Thank you for a wonderful talk. I learned so much. Do you think medical aid insurance data on the costs of the funds of certain diagnosis should contribute to the funding models considered by NHI, given the impact of PMBS on diagnosing behavior and payment of services? Quite a long question.
I'm not sure if I understand the question. If he doesn't mind, if you can maybe unmute himself and ask the question.
Yeah, because he talks about medical insurance data and funding thereof for certain diagnosis. Should they contribute? Because I think it's more about NHI more than about artificial intelligence. Peter, do you want to maybe expand on your question? You can just unmute yourself. I think generally, because medical insurance, they collect data, and it says that data that has been collected, it can be used to fund certain diagnoses that contribute to the funding models, like in NHI and we also the PMBS. So maybe that's use that data to better manage conditions and reduce the cost of managing these patients. Basically, that's something that's the way I understand this question. Utilize the data received to reduce costs for managing patients. Yeah,
I think for me, just in principle, the intent of NHI and to facilitate equitable access to care, I do think there is a room definitely for the private and the public sector to collaborate. And at this present moment, I do think that the private funding sector actually has more data that is stored that is easy to access, aggregate, etc., compared to the public sector, where there are some challenges with regard to the information flow and storage, etc. But at the same time, when it comes to PMBs, I think we also need to be a little bit cautious, because some of our colleagues are using what we call cheat sheets, which basically it's let's game the system and provide all the ICD-10 codes that actually, make the condition qualify for PMB. But I do believe that a whole lot of us are ethical and we do the right thing. So but it's also just striking a balance between those. Thank you.
Yeah,
I think if I could comment on that question.
Okay, sure.
The problem is that the data is there, but people will use it for different purposes. Generally, in medical aid, it's about containment of cost. It's not about increasing access to care. But if you come with an NHI where you want to provide services, you can use the same data to show you where the costs are, so that you can come up with purchase strategies to contain the costs, not necessarily to deny care. But in the current environment, that is used for people to say, this is an expensive procedure. They then redesign their benefit to exclude it out of benefit or to make it ex gratia. They never use the information to the benefit of the people they cover to say, COVID is here. How do we ensure that everybody gets a COVID test? If you remember, what did the medical aids do? They wanted it out of PMBs, and CMS and the DOH had to insist that medical aids must pay for COVID tests for people that are covered. So the information is there, but it's about what is the intent of the organization, what is the primary duty, who's your shareholder. If I'm an administrator, my issue is to ensure that administration fees are paid and the fund doesn't go bankrupt.
Okay.
The priority, the health and access of the patients is not my priority. And I just need to make sure that I rewrite my scheme rules to ensure that I protect the fund financially.
Yeah, definitely. Yeah, because I think because the main purpose of data that we're collecting should be to advance patient care. But sometimes people want to use it to increase revenue for themselves or to minimize costs. As we did in Malawi, it's about a POPIA, Protection of Information Act, says that data can be abused. And how does one start to lodge a complaint against abuse of one's data by entities that acquired it unofficially? I think it's more about regulation and so on. I don't know if you want to mention to that, Doc.
There is an information.
Yeah, because when your data has been used, I can hear you. What it says that in terms of POPIA Act, Protection of Information Act, but personal information. But then if it is being acquired wrongfully and they're using it without your permission, how do you go about to lodge a complaint against whoever has access to your data and used it wrong without permission?
Mm-hmm. There is an information regulator. I'm not going to claim to be an expert, but I do believe that POPIA has touches on that. And the information regulator, there is an ombuds, and I think it's all about reaching out and laying a complaint against whatever entity that is abusing data, personal data.
Yeah. Yeah, I think that. I think most of the times when you read the POPIA Act, it does direct you as to what to do when you feel that your rights have been violated. Okay, thank you for that. I don't see any further questions. Let's see the last one. I think just to say thanks, Light here. We really appreciate people coming and joining us. I'm going to ask if there are no further questions. I'm going to ask Dr. John Mohopa, who's our group occupational health manager, just to do the closing remarks before we come to the end of this presentation.
Thank you very much, Dr. Bila. Good evening, colleagues, and good evening to Dr. Kubheka. A wonderful presentation indeed, eye-opening, and I think, once again, presentations that, dig deep into our, trade and our practice, and for us to try and reach out, to different fields of new and groundbreaking stuff. I wish to thank everybody who came on, to listen to this presentation, and once again wish to remind colleagues to join in, next week for, yet another, groundbreaking presentation. On behalf of Clinics Health Group, of the marketing team, the clinical team led by Dr. Bila, I'd like to thank everybody who participated. I see our profile is growing. We've got Dr. Letlape who came to listen in. We thank you very much, colleagues, and once again, tune in next week for yet another interesting presentation. Dr. Kubheka, thank you very much, and good night, colleagues.
Thank you. Good night.